Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, there's a disturbing worldwide health trend involving fatty liver disease that is not caused by the overconsumption of alcohol. Now, in the past, most fatty liver problems, which often led to fibrosis and life-ending cirrhosis, were caused by excess alcohol intake. But in recent years, a new fatty liver problem has swept across the globe, which entails a very serious fatty liver condition that is not caused by alcohol consumption, known as non-alcoholic fatty liver disease or non-alcohol steatohepatitis. Now, in most cases, the cause of this problem is lack of physical activity and or a high-fat diet or high refined sugars in the diet, as well as obesity. According to the most recent reports, non-alcoholic fatty liver disease now affects 20 to 30% of the world's population. It's unbelievable. More specifically, it affects 20 to 35% of adults, 15% of children, and is found in up to 80% of individuals who are obese. Now, it also occurs quite commonly in type 2 diabetics and in patients that have a lot of fats in their bloodstream. They have hyperlipidemia. This is all due to its association with insulin resistance and metabolic impairment. However, non-alcoholic fatty liver disease can also affect individuals who are at their normal weight and without metabolic disorders, which accounts for about 16% of the cases. Now, fatty liver problems occur when more than 5% of liver cells become filled with fat, which often triggers events that tend to progress towards liver fibrosis. Now, further progression can lead to cirrhosis and an increased risk of primary liver cancer known as hepatocellular carcinoma, something you don't want to develop. So it's important to get this problem diagnosed in the early stages when it's still reversible and non-life-threatening. So I'm referring to fatty liver disease not caused by alcohol. You get it diagnosed early, you can reverse it. Now, your doctor should order standard liver function tests at your annual physical exam. If your ALT and or your AST blood levels are elevated, then an abdominal ultrasound, MRI, or CT scan may be warranted to help confirm the diagnosis of a fatty liver problem. As a rule, non-alcoholic fatty liver disease is a silent disease with very few manifestations, so you don't really have any symptoms until the later stages. And then suddenly, the individual develops advancing fibrosis or cirrhosis, which requires a liver transplant, or their condition progresses to liver cancer. So catching this problem early and reversing it is very important because there are no symptoms until it reaches the later stages. That's why getting blood work done every year is a great idea. The main treatment for non-alcoholic fatty liver disease is lifestyle modification involving weight loss, increased exercise, reducing calorie consumption, especially high animal fat foods, fried foods, sugary carbohydrates. But emerging evidence also suggests that vitamins and minerals also play a key role in preventing and reversing early stage non-alcoholic steatohepatitis. Now, a brilliant review paper in 2012 in the journal Curis highlighted the important role played by vitamins A, vitamin B3, which is niacin, vitamin B6, which is pyridoxal, vitamin B9, which is folic acid, vitamin B12, vitamin C, vitamin D, and vitamin E. As the researchers detail, these vitamins can help to suppress the liver inflammation, quench free radicals in liver cells that are known to do significant damage in cases of non-alcoholic fatty liver, help preserve the integrity of liver cell components like the mitochondria and the endoplasmic reticulum, repair some liver cell damage that's already occurred, help to shuttle fats out of the liver, and provide other preventive and therapeutic effects to support the health of liver cells. In fact, supplementation with 800 IUs of vitamin E is one of the medical guidelines for the treatment of non-alcoholic fatty liver disease. So in addition to remaining fit and staying at or near your ideal body weight, avoiding fatty animal products and fried foods, and being careful with too many carbs, some good evidence suggests that taking a high-potency multiple vitamin and mineral each day that is enriched with higher levels of antioxidants like vitamin C and vitamin E as well as a B50 complex, may be one more important step to help prevent and better manage non-alcoholic steatohepatitis, also known as non-alcoholic fatty liver disease. It's when fat accumulates in the liver in a situation that's not linked to alcohol consumption. So I've included the references for this information in the text below. Thanks for watching, and I'll see you next time.